Hi, my name is Dr. Raney. I'm from Durango, Colorado. I chair the American Psychiatric Association's work group on integrated care. For the past 5 years, I've been working in integrated settings across rural Colorado, and I want to share some of those experiences with you today. I want to start by talking about what integrated care is. And the way that I define it is it's a structured approach to healthcare delivery where you're concurrently treating both behavioral health and general medical conditions. It's the structured approach part of this that's important. If we follow that approach, we have been able to show that collaborative care models can improve outcomes, reduce costs, and increase provider and patient satisfaction. Now let me explain a bit about the use of the terms collaborative care and integrated care. They essentially mean the same thing. The way I think about it is systems integrate and professionals collaborate. And you'll hear people in the field go back and forth between that terminology, and they're essentially the same thing. In the field of collaborative care, there are a range of opportunities for this model to be utilized. The range of opportunities for delivering collaborative care models is usually based on the setting. So in the primary care setting, the goal is to improve the identification and treatment of behavioral health conditions. In public mental health centers, the goal is to improve the health status of patients with mental illness, primarily the severely mentally ill population. As most folks know, there's a 25-year mortality gap in the lives of people with serious and persistent mental illness, and the goal is to begin some treatment of their chronic health conditions. In my organization, I work in several locations providing collaborative care. I'm a consultant psychiatrist in a federally qualified health center in a rural community. Consultant psychiatrist is an important part of the collaborative care team. We work behind the scenes supporting the primary care provider and a behavioral health provider who are on the ground in the clinic, providing telephone consultations, telepsychiatry consultations if needed, and occasionally in-person consultations. This has been an enormous amount of fun for me. I understand that I am able to reach many more patients than I can in my usual office practice. In addition to working in the federally qualified health center, I also provide consultation to several local school-based health centers, including a high school, an elementary school, and an alternative school. Working with pediatricians and family practice providers in these settings has been a lot of fun, and they really value the consultation and expertise that psychiatrists can provide. I also meet every month in team meetings with them where we can discuss difficult patients and those who aren't improving. This is a very important aspect of the collaborative care model. Collaborative care isn't all that I do. I have a small private practice. I see patients in the community mental health center. I see consults in the hospital and provide services to the jail. Collaborative care is often some of what a psychiatrist does and not all of what we do. It's very important if you're going to work in collaborative care settings to get proper training to work in these models. Psychiatrists are in a very unique position to provide leadership to these collaborative care teams. We need appropriate training in order to be able to do this. You need to understand the models, what the role is, and psychiatrists can be the keeper of the model, making sure that there's fidelity to it. It's so tempting in these primary care settings to regress back to a co-located situation, which is where folks are often most comfortable. Psychiatrists will need to learn a new skill set to be successful on these collaborative care teams. We need to learn about managing populations of patients. We need to understand the significance of measurement-based care, and we need to realize that we're in a unique position to lead these teams. We're trained in both the medical and the behavioral health world, and that skill set will help us be leaders in the integrated care movement. In summary, I'd like to say that my work in collaborative care has been professionally rewarding in ways that it's sometimes hard to express. I've had the most fun in the last 5 years working in these models, and I encourage you to think about becoming trained and experienced in these models because they allow us to extend our expertise to a larger population of patients.